Radyo Trabaho, ang inyong gabay sa hanap buhay.
Mahirap ba maging Grab driver?
Graduate po ako ng K-12. Qualified ba ako para maging call center agent?
Meron bang insurance ang mga angkas driver at passenger nito?
Usapang Trabaho, sasagutin ang pagdapak sa inyong mga tumpak na tanong. Usapang Trabaho, isang programa na ang sentro ng diskusyon ay ang iba't ibang propesyon. Malayo man kayo sa kanilang katayuan, pero meron kang matututunan sa Usapang Trabaho. At kung ikaw ay naghahanap ng trabaho, ito ang programang swak na swak para sa iyo. Dahil may mga job openings mula domestic hanggang abroad, ang ibabahagi namin sa inyo. Usapang Trabaho, kasamang dalawang masisipag sa pagbibigay ng trabaho, Boss Rod Marcelino at Boss Ramcy Tirona. Usapang Trabaho, basta trabaho, tutog na, araw-araw, sa unang-una, nag-iisa at tunay na gabay sa hanap buhay. DZXL 558 Radyo Trabaho.
Alas 11:07 mga kasama ng magandang umaga, partner. Good morning. Happy
Good morning
Monday.
din and happy Monday sa'yo, partner.
Kumusta?
I'm doing good naman. And how was your weekend, partner?
Okay lang, partner. Eto, patuloy pa rin nating binabantayan, sinusubaybayan, minomonitor mga kasama ang sitwasyon ng ating bansa. Kaugnay nga rito sa NCOV. Opo, kahapon na naibalita po yung isa na namatay na.
First out of China na death na may kaugnayan nga sa NCOV. At ang kauna-unahan dito pa sa Pilipinas.
Dito sa Pilipinas. Anyway, kasalukuyan pong may press conference dyan po sa may Malacanang at nandyan po nakaantabay si XL Radyo 4 partner para batid sa atin, no?
Para malaman ng lahat.
Malaman din ng
kung
lahat.
ano na ba ang gagawin ng pamahalaan tungkol nga dito sa issue ng NCOV.
Kasi may mga panawagan din total travel ban sa lahat ng mga Chinese. Hindi lang dun sa galing sa Wuhan at galing sa Hubei.
Pero buong ano na talaga.
Bansa ng China. Pag galing ka doon, huwag ka munang pumasok. At doon sa ating mga kababayan na pabalik.
Yung mga pabalik daw, if 14-day quarantine para.
So, baka isa din yan sa mga pag-uusapan dyan, partner,
sa press con na nagaganap.
Sige, partner.
At ito, kasama na nga natin, XL Radyo 4, Angel Ronquillo. Angel, good morning. Radyo Man Angel.
Or likely importations of cases and to better manage those cases. WHO commends the actions taken by the Filipino government to strengthen its preparedness, to build capacity to detect cases, and WHO continues to work together with the Department of Health Philippines and the Filipino government to increase its preparedness and response capacities to deal with this outbreak. We remain confident that the outbreak can be controlled and we can prevent expanded spread of this disease. To date, there have been more than 17,000 cases reported. The vast majority of the cases continue to be reported from the People's Republic of China. The outbreak has also unfortunately resulted in the death of 362 people, all of them in the People's Republic of China, excluding the one death which happened on Saturday here in the Philippines. The disease has now been reported from 23 countries, several of those countries also reporting local transmission, although most of the cases that those countries have reported had a travel history to affected areas in Hubei province, particularly to Wuhan. WHO reiterates that WHO has made available and is mobilizing all resources in its capacity at country office level, in the region and globally to address this emergency of international concern and we will continue to work with the Department of Health Philippines and the Government of the Philippines to increase your preparedness and response capacities. WHO is confident that at this point of time, there is no community spread of the disease as per evidence that is currently available within the Philippines. We want to reiterate that the 2 cases that have been reported here in the Philippines were both from travelers who originated from Wuhan, who actually traveled with early signs of the disease. So we commend the government of the Philippines for the measures it's implementing, and we work in partnership with them to strengthen their response capacities. Thank you.
Thank you, Dr. Rabi Abayasing. Thank you, Dr. Celia Carlos, Yusek Ernie Abelia, and Bureau of Immigration spokesperson Dana Sandoval. I turn over to Undersecretary Roque Ignacio for the press conference.
Okay. Question. Raymond Tinasa, then Mela.
Good noon, ladies and gentlemen. Kay Secretary Andanar siguro. Now, yung papatuparin o pagpatupad ng temporary travel ban, kasama ba dito ang, for example, yung mga, may concern kasi yung mga doctors from US who are planning to travel for a medical mission sa Guimaras. Nagtanong sila kung kasama ba sila kasi meron silang layover or stopover sa Hong Kong and mainland China. Then back then to Manila. Kung kasama ba sila sa ban sa entry sa Pilipinas?
If they are part of the delegation po hello there. If they are part of the delegation of the WHO and government efforts in combating the virus, then they will be allowed to enter the Philippines.
No, I mean, not necessarily part of the delegation of the WHO, but only doctors, regular doctors from US who are traveling to the Philippines, but they have a layover or stopover in Hong Kong and China. So they are part of the affected to be barred entry.
Doon po sa directive na natanggap natin from the Office of the President, all Filipino nationals po. So, lahat po ng dadating na Pilipino are subjected to the assessment of the Bureau of Quarantine. They will also not be allowed to depart the country.
Yung not necessarily Filipino nationals, say US nationals or European nationals who are coming to the Philippines, but they have a scheduled layover or stopover for 4 to 5 hours in the airport, then flight to Manila.
Even transiting passengers po, basta bumaba po ng Hong Kong, mag-layover po sa Hong Kong, mag-transit, they will still not be allowed to depart, to enter the Philippines.
Kay Undersecretary Abelia, sir, now that umiiral na yung temporary travel ban and our local aircraft or airplanes, PAL and Cebu Pacific, already canceled or suspended flights to and fro from China to their SARS. Ano yung magiging arrangement for yung aircraft nila? For example, from Wuhan or from Hong Kong or from kung wala naman ng bibiyahing airline?
Tulad ng report kanina, inaareglo ng gobyerno natin na may mapadala tayong aircraft na patungo sa affected areas na yon. So, ang expected po ay sometime this week. Yun ang target date, makarating doon para i-ferry back yung mga nag-volunteer na magpaparipate.
Thank you.
Okay, Mela, then Maricel and Saliman.
For Ms. Dana of Bureau of Immigration. Hi, ma'am. I know it was already mentioned earlier, but just to reiterate, since there are so many criticisms, it was January 31 when WHO declared the 2019 nCoV ARD as a public health emergency of international concern. Prior to this declaration, do you think the Bureau of Immigration make necessary or enough actions to quell the spread of the contagion?
Yes po, we believe so po kasi we work with the recommendations of the Department of Health and we cannot implement policy changes with regards to travel ban unless directed by the Department of Foreign Affairs and the Office of the President. So lahat po yan, we take into consideration the recommendations of the Department of Health, which is based on the recommendations of the World Health Organization.
And last one question na lang, ma'am. China declared human-to-human transmission of the nCoV on January 20. Then Singapore, with 13 confirmed cases of nCoV, banned travelers with recent visit to China on January 31. The Philippines, with 2 confirmed cases, made a similar ban on February 2. For BI, do you think government response is just right, or is it late as alleged by some critics?
We believe po that it's just right kasi like I said earlier po, naka-ankla po tayo on the recommendations of the World Health Organization and ang ating Department of Health is equipped in assessing the situation and the needs of our country kung kailangan po natin ng travel ban. So yung naging response po natin is appropriate naman with the recommendations of the World Health Organization.
Okay, thank you. Maricel?
Yusek Abella or Secretary Andanar, good morning. Sir, what will happen to those OFWs who are just here in the Philippines for vacation? Will they be allowed to go back?
Temporarily po, due to the travel ban, hindi po muna because wala pong distinction between visa types dun sa lumabas po na direktiba dun sa travel ban. So lahat po ng Filipino nationals who are in the country will not be allowed to depart for the Hong Kong, China, and Macau.
But given that situation, since yun po kasi yung source of income nila, of course, so I understand some of them are concerned what will happen to their jobs in China or in Hong Kong or in Macau. What's the plan of the government for these OFWs?
We fully understand po because kung yun ang talagang kinabubuhay nila, but I believe po the POEA and the OWA will be doing their part po in ensuring na itong mga trabaho po nitong mga ating kababayan abroad ay mananatili despite this travel ban.
Ma'am, just a clarification on the quarantine of Filipinos who are coming back here. Paano po yung magiging procedure nun? Dun sa mandatory quarantine, talagang self-quarantine lang yung gagawin sa kanila?
It might be best po for the Bureau of Quarantine to answer this question because they are the ones po who are implementing the quarantine. In immigration po, we process the documents of the person and the person itself. But when it comes to health matters upon arrival, it's really the Bureau of Quarantine.
Okay, thank you
Okay,
po.
Salima?
Hi, to Dr. Rabi of the WHO. Sir, can we just get the reaction of the WHO to news coming from Thailand that a certain cocktail of antivirals used to treat flu and HIV is used to treat nCoV patients, and apparently there's one who had a dramatic improvement. What do you know about this?
Thank you for the question. We've seen media reports of this. As you know, the declaration of a public health emergency of international concern also encourages research into better managing patients and looking for treatments and preventive interventions such as vaccines. So we encourage evidence-driven efforts in that direction. We've seen reports coming from Thailand. Of course, the improvement of one patient does not constitute evidence. WHO will work more closely with the authorities in Thailand, but also we are continuing to work with the authorities in China and with other research institutions to build evidence of what practices should be adopted by affected countries to improve case management, to prevent the transmission. And no sooner there is clear evidence of what works, WHO will share that. In the meantime, WHO has shared interim guidance with member states on how to prevent and control infection, how to manage cases, and how to do diagnosis of suspected patients through lab testing. So we need to recognize that this is an evolving situation. It's a new disease, And WHO remains committed to working together with the global research community to generate that evidence and share it with member states when available.
Okay. Sir, right now what we know is that transmission is through droplets, respiratory. But in the US, I understand there was a patient where they found the virus in the stool sample. What do you know about this, and is this alarming?
So we know that the virus will be contained in body fluids, and usually it being a respiratory disease, the commonest mechanism of transmission from symptomatic individuals is through sneezing and coughing when droplets containing the virus are either absorbed by somebody in close proximity or rest on some surface which then becomes a fomite, an infected surface, the touching of which could help transmit the disease to somebody else, because you touch where the place where the virus is and then touch your eyes or nose or mouth, and the virus can enter you. So that's the common mode of transmission. But it's not unknown that coronaviruses can cause intestinal side effects, and so reports that viruses are contained in the feces are not entirely unexpected, but we do believe that that's not the primary mode of transmission of this outbreak. The reports of the presence and possible implications for its transmission through fecal-oral routes are being investigated but not as yet confirmed by WHO.
To Dr. Carlos and maybe Secretary Andanar, given na wala pa naman po talaga na kumakalat sa mga Pilipino, wala pa pong community spread, ito pong nCoV. Pero yun nga po that posible pa rin naman through...
I think that the same thing will be later evident from the novel coronavirus. So what do? We need to strengthen advice to the public to practice oral and proper food hygiene, to wash their hands well before and after eating, before and after using the toilet, which is not really common because we see many Filipinos using the toilets without washing their hands before and after. So we need to strengthen that information, and we need to be careful about disposal of feces. They should be properly contained and put in the proper waste disposal bins, especially for areas where there are no established sewage systems. So I think for now, those are the recommendations, especially in areas where there are no established sewage systems.
Secretary Andanar, would you know po if meron tayong quarantine facility na sabi nila Magsaysay or in Caballo Island, ano po ba yung balak po gawin doon, lalo na po doon sa mga babalik po ng mga Pilipino from those countries po?
Ang sinabi po ni Secretary Duque is they're considering Fort Magsaysay kasi nga sa laki ng facility at pwedeng i-quarantine doon kahit na ilang daan o libong pasyente. 10,000 yung actually capacity ng Fort Magsaysay. Pero yung sa Visayas and sa Mindanao, bukod dun sa mga ospital ng ating Department of Health, wala pang nababanggit sa akin si Secretary Duque kung saan i-quarantine yung mga possible carriers itong nCoV. But later on, we have an emergency meeting with the President, and after that, we will have a press conference. So baka pwedeng itanong mo ulit dun sa merong dagdag po si Dr. Carlos.
In the interagency meeting last Friday, the plan was for a team from the DOH, from quarantine, from immigration, DFA, to visit the prospective facilities. That includes Fort Magsaysay. So depending on the findings, the decision will be made on where to quarantine the returning Filipinos.
Pero po, nagsimula na po silang bumalik. kahapon po tayo nag-start nung atin pong issue ng temporary ban. So syempre po yung mga nakabalik po mga Pilipino, although alam nila may self-quarantine, hindi po nila alam kung saan sila pupunta, kung ano po ang gagawin. Hindi po kasi malinaw yon sa public na, kunwari ako po, dumating ako, babalik po ako sa pamilya ko at sasakay po ako ng bus, sasakay ako ng taxi. So, yung ganun pong pag-aalala, paano po ba natin yun makokontrol?
So far, ulitin ko lang po yung sinabi natin kanina na yung proposal po yung wala pa pong nabalik mula sa Wuhan at sa Hubei province.
Pero po sir, yung mga galing China, Hong Kong, Macau, syempre po kabado po sila ngayon. Bumalik po sila kahapon. So, ano po yung instructions natin sa kanila? Paano po tayo magsa-self-quarantine? Paano po yung proseso?
I projected the decision tool earlier in my presentation, and there's a part there where if personnel returning from China have no symptoms, no fever, no respiratory symptoms, just a history of travel, they need to do self-monitoring at home. So they stay at home, preferably separated from the rest of the household. If they can stay in a separate room, that's much better. They are advised to wear masks for around 14 days from arrival, from the date of arrival, until they complete the 2 weeks. If they have no symptoms, then that's it. But if they develop symptoms, they are advised to go to a facility which can evaluate them. So that's the general instruction.
Okay, thank you, Salima. Can we have
and sorry, to monitor their temperature twice a day.
Okay. Can we have our friend from? Please state your name. Microphone, please.
Hello, I'm Sarah Gomez from International News Agency FM. My question is for Bureau of Immigration. I would like to confirm some reports I've read in this morning about that some hundreds of foreigners, including 300 Chinese nationals, stranded in the airports. I don't know if all of them are in Naya. Apparently, right now, they weren't allowed to get into the Philippines, but now they can leave because there are no flights available. Can we confirm that figures and to know what would happen to them?
Yes, that's true. There are around 300 Chinese nationals who are stranded in NAIA because most of the airlines have canceled their flights already to and from the different parts of China. But our office is coordinating with the Chinese embassy, and they have pledged to send an aircraft to fetch their citizens who are stranded in the country. And maybe today or in the next few days, we'll find out the details of this flights that the Chinese embassy will be arranging.
And where are they now?
Currently, they're still at the NAIA.
There's a specific area in the airport? They are only Chinese, or there are also foreigners from other?
There are also other foreign nationals, but most of the ones that were stranded since yesterday have already departed.
Okay. And I have another question for Undersecretary Abella. Can we know, I don't know if, can we know when can we expect the arrival of the Filipinos repatriated from China? And I don't know if you have an idea of how many of them will be have already requests to be repatriated to the Philippines.
All right. As of an hour ago, 45 minutes ago, we found out that about 40 Filipinos have already requested to be repatriated. The expected goal is to be able to fetch them within the week. That is the intended goal. So
40?
40, yes. Thank you. From Wuhan, Hubei province, yes. Thank you.
Thank you, sir.
Okay, Tuesday New.
Kay Ma'am Dana po. Hi, Ma'am. Nababanggit po kanina mayroon ng 23 countries na affected ng coronavirus. Pero nakakonsentrate lang po tayo ng travel ban sa China, Macau, at saka Hong Kong. Yung iba bang bansa na affected na rin ito, like Taiwan, for example, Malaysia, mayroon na rin recorded, Singapore, wala ba tayong i-impose din na travel ban dyan sa mga, safe ba tayo sa mga dumarating na citizens nila or other nationality coming from that countries, papunta rito sa Pilipinas, or tayo naman ipupunta din sa kanila?
Siguro po kung may changes in policy dito sa ating travel bans, if there is a need to expand it, it will be recommended po by the Department of Health and the World Health Organization.
Yeah, ang concern lang ma'am is baka masyado tayo nakakonsentrate sa China, Macau at Hong Kong, baka malusutan naman tayo dito sa iba pang other countries na affected na rin pala nitong coronavirus.
Yes po, we believe naman po that the capacities of our Department of Health, also the World Health Organization, is enough naman po to guide the President and our other government agencies in crafting changes in the policies po dito sa travel ban.
Okay, thank you.
Thank you.
Francis, microphone please.
Good morning po, sirs, ma'am. Ma'am, Sir Andinar, tanong ko lang, nagkaroon po ng komento si Vice President Leni Robredo about sa hindi raw maayos sa pagbibigay ng impormasyon ni Secretary Panelo about the coronavirus. Ngayon, in-encourage na si Presidente Duterte na as the head of the government na siya po ang lumabas sa publiko, magbigay ng update para at least ang mga tao po mas mapanatag sa nangyayari ngayon sa atin. With regards sa virus po, ano pong komento ng palasyo dun, sir?
We respect the suggestion of the Vice President. Mamaya meron tayong emergency meeting with the President at exactly pag-uusapan itong 2019 and coronavirus. Then after which, there's a press con, so you may ask the President later on. Thank you.
Okay, Rosalie, then yellow.
Good morning po. Kay Miss Dana po. Ma'am, may exceptions po ba dun sa travel ban? For example, meron pong nakascheduled na operation sa China or kaya sa Macau and Hong Kong, and pati po ba yung mga diplomatic personnel ay exempted dun sa travel ban to China?
Yung mga Filipinos po that would be departing the country, wala pong exemptions na nakalagay doon. But of course, for such reasons po, if there is really a health emergency, maaari po siguro through the recommendations of the Department of Health din. Kasama din po yung isa pong question na nag-emerge yung mga dual citizens, kung maaari po ba silang umalis ng bansa, given that they are both Filipino and foreign nationals. Sa atin po, we allow the departure po upon presentation of the foreign passport.
Pwede rin po bang makuha yung bilang kung ilan na po yung hindi po pinayagan na makapasok ng bansa? Mga Chinese and foreign nationals na nanggaling sa China and other special administrative regions.
Sa ngayon po, we are still collating the figure kasi the directive just happened yesterday morning. So kinokolekta pa po natin yung figures, but perhaps in the next few days po, we will be able to give you a more concrete number.
Last na lang po, i-clarify ko lang po yung naging statement nyo kanina dun sa mga OFW na hindi makakabalik dahil sa travel ban. So ang OWA ang magbibigay ng assistance. What particular assistance po?
Siguro po, coordination with their agencies para po maprotektahan yung kanilang trabaho bago pa po sila makabalik sa bansa. Given the situation, I'm sure everyone understands that each country has been conducting their own restrictions when it comes to travel because dito nga sa kumakalat na sakit na ito. So I'm sure that people will understand that that we are doing this, the government is doing this for the protection of everybody.
Okay, Ms. Yellow, then Pia and Ace.
Morning. Yellow from China Central Television. I have a question to Secretary Andanar. Because yesterday I saw a post by Ambassador Chito Romana in his Facebook, and he posted a song written by Filipinos living in Wuhan. And in this song, these people said, I hope I'm pronouncing it right, Pangong Wuhan tayong magkasama-sama, Pangong Wuhan tayong magkakaisa. So this kind of song encourage people in Wuhan and all around China very much. So I would like to know from the Philippine government, do we have any message to Chinese people, and especially to this Filipino who choose live in Wuhan? Thank you.
Thank you for that question. In fact, I have seen several videos online of Chinese people chanting that specific song that you were saying. Yesterday, we did release a statement against discrimination, that we should not discriminate people, especially Chinese, who are affected by this coronavirus. This is not the trait of the Filipino. It should never be the trait of a Filipino. And we did mention also that there were several times, or numerous times, that we were in need, and countries around us like Singapore, Malaysia, China, even the Americas and Europe were there for us. So we should be also there for the Chinese people who are suffering this coronavirus in prayer and also in support. There should be no room for discrimination. I will be asked. Do you have an answer for that? Kung meron. Okay, so later on I have a meeting with the president, and we will ask the president what his message is to the Chinese people. Thank you.
Thank you. I have another question to Dr. Rabinja from WHO. You just mentioned that all the states need to work together to prevent this kind of transmission of the virus. So I would like to know some comments from you about how do you see Chinese government's actions, like they lock down quite a lot of cities to prevent the spread of the virus, and Chinese government built a hospital in 8 days to contain a lot of people there. So I would like to know from the WHO side. Thank you.
Thank you for the question. WHO acknowledges the proactive role that China has played right from the beginning of this outbreak, transparently sharing information as it becomes available, sharing knowledge, the identification of the pathogen per se, defining its whole genome sequence, sharing that and sharing diagnostics. Also sharing information about the clinical presentations, the manifestations, and how the patients are managed. All of that has been valuable in helping WHO better understand this disease. So as our Director General mentioned, when he met President Xi Jinping, we are very appreciative of those efforts of the Chinese government. We also are encouraged by the measures China is implementing to contain this outbreak, both in Wuhan and Hubei and within China, but also from spreading to other countries. WHO acknowledges and is monitoring closely China's efforts to lock down approximately 50 million people now to contain this outbreak. As WHO has mentioned, this is unprecedented in global public health, and we are closely looking at its effectiveness and what its relevance would be for future global efforts in containing these kinds of epidemics. We also appreciate the early efforts implemented by the government of China in implementing a travel ban for tour groups to travel abroad, and in early implementation of exit screening to screen patients leaving China. These are important experiences that WHO is trying to understand and see what is replicable and good, so that we can learn from these experiences on their potential usefulness. And we continue to work both on the ground in China with your specialists to better understand what is necessary to control this disease and to help control the disease in China.
Thank you so much, sir. Last question to anyone who can answer it, because we just mentioned in the press conference that there's no local transmission here in the Philippines yet. But what the government prepared to do in case this outbreak will happen in the Philippines, because maybe we will face some shortage of the equipment like face masks, and especially like the doctors and the nurses in the hospital, their equipment maybe face a shortage. So I would like to know how the government will do in face this.
Based on our recent meetings in the Department of Health, as early as now, there are efforts to procure huge amounts of personal protective equipment. not only from local sources but even from international sources, in anticipation of a possible wider spread of this coronavirus. And of course, we are still at the containment phase, which means there's no community transmission. That's why a huge amount of effort is currently being implemented to identify possible people who may transmit the disease. As you know, there is contact tracing of the persons who were found to be positive, and that's not a small amount of effort. You identify all the possible contacts of that patient, you assess their health condition, you treat them, or you quarantine them if necessary. So those are really very huge measures being undertaken to avoid the transition of the country from simple containment to mitigation. So hopefully we will not reach that particular stage.
Okay, we still have, thank you. Yeah, we still have Pia, Ace, Mikael, Chona, and Alvin.
Okay, Dr. Carlos, po, as a follow-up to the question of Ms. Yellow, you mentioned a while ago that the RITM is preparing for a possible surge of people that you need to check whether they have the coronavirus. Could you tell us more about your preparations, ma'am?
We have a surge capacity plan for training subnational laboratories to be able to do the test. But since we just acquired the technology fairly recently and started testing Thursday last week, we may need to, first make an assessment of 5 subnational laboratories previously identified. In fact, we have been training them for influenza surveillance since almost 5 years ago, and the test for coronavirus uses the same test format. So it will not be difficult. We just have different reagents and different primers. So we have that plan, and in the last command conference of the DOH, there were already measures laid out on how they can be provided capacity to do the test.
So in the future, ma'am, we may be able to activate 5 more laboratories for the testing?
Yes.
Okay. Ma'am, follow-up lang din po dun sa, or just to clarify yung nabanggit niyo po kanina, returning Filipinos from China, if they do not manifest any symptoms, ang meron lang sila is a travel history to China, they can self-quarantine. But what about those coming from Hubei province or Wuhan po?
I think the same recommendations hold. The decision tree is clear. If you have no symptoms, you just have an exposure to, by travel, then you can do just self-quarantine.
Kay Ms. Dana po. Ma'am, ito po, is that being explained in depth dun sa mga bumabalik po na Filipinos from China?
Sure. Yes po, we are in close coordination with the Bureau of Quarantine, who does the explanation po when it comes to the pagka-quarantine po nitong mga dumadating natin na OFWs. So they are advised po kung ano yung mga kailangan nilang gawin, and then sila din po yung nagsasabi kung ano yung step-by-step na dapat gawin at kung saan po magre-report kung sakali pong makaramdam ng any symptoms of the coronavirus.
Ma'am, ano pong ginagawang basis ng Bureau of Immigration to verify kung totoo yung sinasabi na travel history ng isang tao?
Passports po, makikita po yan sa passports kasi kasama po dito sa travel ban is not just yung pinanggalingan niya but the travel history within the last 14 days. So makikita po sa passport kung saang bansa po nanggaling. So if within the last 14 days the person, the foreign national came from Hong Kong, China, or Macau, automatic po we can deny this the entry of this person. At the same time po, nagpadala na rin po tayo ng advice sa airlines, hindi pati po sa mga shipping agents to pre-screen the foreign nationals that are boarding their vessels to make sure na hindi na po makasakay at itong mga foreign nationals na to para po maiwasan na kailangan pa natin silang ibalik. And pre-screening po really is to the advantage of the company dahil hindi na po nila kailangan ng added cost para ibalik pa po yung taong ito since automatic disqualified naman na po yan kapag pumasok sila sa bansa.
Last na lang po kay Secretary Andonar. Sir, what do you say to criticisms na yung emergency meeting later ay masyado nang late considering na last week pa po na report yung first death from coronavirus in the Philippines?
No, it's not late. In fact, very timely ang desisyon ng gobyerno. Again, we follow also the directives and also the recommendation from the World Health Organization, the Department of Health. Again, I would like to reiterate na itong namatay na infected by the coronavirus is a person from China. At yung infected din yung kanyang kasama. Wala pang Pilipino. Thank God na infected nito. Yung desisyon naman ng gobyerno ay very methodical. At yung meeting mamaya ay nataunan din na timely because nung weekend namatay yung pasyente na galing pan China, and unfortunately the first death outside China.
Sir, sino-sino yung mga kasama dun sa meeting and what can the public expect dun sa outcome ng meeting na yan?
Hindi ko masagot kung sino-sino because I was also just informed. Pero ang nakalagay doon, Pia, is select number of cabinet members. So meaning hindi lahat.
Thank you, sir.
Okay, Ace and then Mikhail.
To our officials, just curious because the first death, confirmed, the first death in the Philippines is the second confirmed case of nCoV. Tama po. Okay. But when the DOH and the government announced the first case of the nCoV, there was no mention of the 44-year-old Chinese man who is already suffering from the disease. May we know why there was no announcement regarding the second case of the nCoV?
I was in the press con when Secretary Duque announced the death of the first case, and he did mention that the first case had a companion, male companion, who was also sick. But at that time, the male companion was not as ill as what happened in the subsequent days. So the illness progressed subsequently, which eventually led to his demise.
Okay, so when he was ill, it was not yet nCoV. It was not yet a confirmed case that time.
It wasn't confirmed.
Okay.
His confirmation came later.
Later. So it just deteriorated fast.
Opo, yeah. His condition deteriorated in the last 24 hours.
Okay, do you have any information as to how many people have interacted or had interacted with the fatality?
This of course will be the health personnel attending to him, and the people perhaps who were exposed during their travels because they traveled to different places in the Philippines. And that is now being investigated by the Epidemiology Bureau.
Okay, thank you po.
Okay, Mikhail. Microphone, please. Alvin, paabot ng mic.
Okay mga kasama, yun po ang punong balitaan sa Malacanang, kaugnay pa rin sa coronavirus, partner. Yung mga hakbang, yung mga plano ng pamahalaan para nang sa ganon ay hindi na po tuluyan pa ito, partner,
nakumalat dito sa ating bansa. Actually, ang dami rin magagandang tanong na nanggaling din sa mga kasama natin sa media, ha? But of course, mamaya-maya pa malalaman din natin. Actually, alam ko, meron din yatang magiging statement si DOH Secretary Duque na kaabang-abang din kung ano mga sasabihin ni DOH Secretary.
Pero alam mo, pabor ka ba na hindi lang China ang ibaban ng pagpasok rito sa ating bansa, kung hindi maging yung iba pang mga bansa na may mga kaso na rin ng novel coronavirus,
actually,
partner.
Marami na maraming countries.
Kasi di ba maraming mga turista na pumuka. Ang issue kasi dyan kung ipapalawig